Dear colleagues, it is a great pleasure for me to present to you today the results of the enzalutamide trial in European and North American men participating in the AFFIRM trial.
The objective of this study was to investigate the difference in efficacy and safety outcomes between European and North American patients in the AFFIRM trial using post-hoc analysis. The design of the AFFIRM trial is well known. Primary endpoint was overall survival. Secondary endpoints included measures of response like PSA levels, objective soft tissue response, and health-related quality of life assessed using the Functional Assessment of Cancer Therapy Prostate Questionnaire. The baseline characteristics of the analysis included 684 European patients with a mean age of 68 years and 395 North American patients with a mean age equally balanced of 69.4. Patient baseline characteristics were generally similar between the regions. Differences that are noted were a shorter median time from initial diagnosis for patients receiving enzalutamide in the EU of 67.1 months compared with North America 89.9 months. Also, a lower portion of EU patients with a high total Gleason score of 8 to 10 compared to North American patients. This is 44 versus 50.6%. A lower prevalence of cardiac disease in EU compared to North American patients was observed. Also, a lower prior and concomitant corticosteroid use. Here you see the Kaplan Meier curves that demonstrate nicely that enzalutamide significantly improved overall survival compared with placebo in both the European and North American patients. There was a consistent enzalutamide benefit over placebo observed across all secondary endpoints in patients from both regions. With regards to adverse events, the overall number of adverse events and serious adverse events with enzalutamide versus placebo was similar between the two regions. In summary, regional differences. The overall survival in both enzalutamide and placebo arms was longer in the European Union than in North American patients, potentially due to the difference in baseline characteristics and treatment patterns within the regions. Enzalutamide significantly improved median time to first SRE compared with placebo in EU patients, but there was no improvement in North American patients. The other way around, more than 5% difference in fatigue incidence between enzalutamide and placebo in North American patients was observed, but not in EU patients.
To conclude, in this post-hoc exploratory analysis, enzalutamide showed a consistent overall survival benefit over placebo in men with mCRPC from both North American and European regions who had previously progressed on docetaxel. Efficacy benefits were consistent across secondary endpoints. There was a comparably safety profile in both regions. Thank you very much for your attention.